Now, what are some of the things that the doctor's office or the senior centers have done to make sure that, or to protect the safety of individuals when they come in for appointments?
So healthcare providers have done quite a bit to protect people if they need to come into the office. They've increased efforts to keep patients, visitors, and healthcare workers as safe as possible at all times. Things that are different is now you can expect a phone call from your doctor's office, usually 24 to 48 hours prior to the appointment. At this time, they're going to ask you some questions such as, are you having any symptoms that might be COVID? And those are usually respiratory symptoms. Are you, have you been exposed to someone that you know is positive, or have you traveled to one of the high-risk states? If you answer yes to any of these questions, they will have to determine at that time whether or not they feel it's safe for you to come into the office. I think the other thing that's different is when you arrive at the office, before you're allowed into the office, there will be a screening of your temperature to ensure that you are not experiencing a fever at the time of the visit. And you will probably be asked the screening questions around symptoms, travel, and exposure to a positive person, again, at that time. Again, we're always working to keep you as safe as possible, all of our patients as safe as possible. You will also be required to wear a mask at the time of your visit. If you do not have a mask, one will be supplied for you. And don't be surprised, because you're going to see all the staff in the office, including the physician, will also be wearing a mask. This is a requirement. You will also, as I stated before, not be allowed to bring a visitor in unless it is deemed necessary that you have a caregiver accompany you to that visit. And that caregiver needs to be 18 years or older, and they will also need to go through the screening process as you do. Cleaning, we are now having to comply with special precautions around cleaning, and cleaning is also more frequent than before. You will notice that in most cases, you may bypass the waiting room. You won't be waiting in the waiting room. You'll be taken directly to an exam room. Or if you go into the waiting room, you'll notice there's less seats in the waiting room, and people will be spaced further apart, again, to maintain that social distancing. And of course, all those other patients who might be in the waiting room will also be wearing a mask as you are. You will notice that appointments are spaced further apart, again, to minimize contact with other people. And you will notice that in most cases, their schedules have been extended to later in the day to allow them to see the patients who require being seen in the office. You will also see that between each patient, there is a deep cleaning of the room to ensure safety for everyone.